Many women come to clinics confused, frustrated, and scared after hearing two words that sound completely different but are secretly connected: PCOS and diabetes. One affects periods and hormones, the other affects blood sugar. Yet, millions of women don't realize that PCOS can silently push them toward diabetes if ignored. Today, I want you to stay with me till the end, because understanding the difference between PCOS and diabetes and how they overlap can literally change how you manage your health, your weight, your fertility, and your future. This is not just information. This is awareness that protects your body. And before we begin, if you care about your health and want clear, honest medical explanations, make sure you subscribe to Medical Truths with Dr. Nimra and like this video so more women can receive the right knowledge at the right time. What is PCOS? Polycystic ovary syndrome, or PCOS, is a hormonal disorder that affects women of reproductive age. In PCOS, the ovaries produce higher than normal levels of male hormones called androgens, which disrupt ovulation. As a result, periods become irregular, ovulation may stop completely, and small fluid-filled cysts can appear on the ovaries. PCOS is not just a reproductive problem, it is a full-body metabolic condition that affects hormones, weight, skin, mental health, and long-term disease risk. What is diabetes? Diabetes, especially type 2 diabetes, is a metabolic disorder where the body either does not produce enough insulin or cannot use insulin properly. Insulin is the hormone that allows glucose to enter cells for energy. When insulin doesn't work effectively, blood sugar levels rise, damaging blood vessels, nerves, kidneys, eyes, and the heart. Diabetes develops slowly and often silently, which is why many people are diagnosed only after complications begin. Key difference between PCOS and diabetes. The main difference is that PCOS is primarily a hormonal disorder affecting women, while diabetes is a blood sugar disorder affecting both men and women. PCOS mainly impacts menstruation, fertility, and androgen levels, whereas diabetes mainly affects glucose control and organ health. However, the critical link between them is insulin resistance. This is where the story becomes serious. Insulin resistance. The common root insulin resistance means the body's cells stop responding properly to insulin. To compensate, the pancreas produces more insulin. In PCOS, high insulin levels stimulate the ovaries to produce more androgens, worsening symptoms like irregular periods, acne, facial hair, and infertility. In diabetes, insulin resistance leads to persistently high blood sugar. This is why women with PCOS are 4 to 10 times more likely to develop type 2 diabetes compared to women without PCOS. Causes of PCOS. PCOS does not have a single cause. Genetics play a major role. If your mother or sister has PCOS, your risk increases. Insulin resistance, chronic inflammation, poor diet, obesity, stress, and hormonal imbalance all contribute. Environmental factors and lifestyle choices worsen symptoms, but PCOS itself is not caused by laziness or poor hygiene. It is a medical condition that deserves proper care. Causes of type 2 diabetes. Type 2 diabetes develops due to a combination of genetic predisposition and lifestyle factors such as poor diet, lack of physical activity, obesity, chronic stress, and sleep disturbances. Long-term insulin resistance gradually exhausts the pancreas, leading to inadequate insulin production. In women with PCOS, this process often starts earlier, making early prevention extremely important. Can PCOS turn into diabetes? PCOS does not directly turn into diabetes, but unmanaged PCOS significantly increases the risk. When insulin resistance remains untreated for years, it gradually pushes the body toward prediabetes and then type 2 diabetes. This is why regular blood sugar monitoring is essential for women with PCOS, even if they are young or not overweight. Symptoms comparison. PCOS symptoms include irregular periods, infertility, weight gain around the abdomen, acne, oily skin, hair thinning on the scalp, excess facial or body hair, mood swings, and fatigue. Diabetes symptoms include excessive thirst, frequent urination, unexplained weight loss or gain, blurred vision, slow wound healing, and constant tiredness. When both conditions exist together, symptoms become more severe and harder to control. Is there a cure? There is no permanent cure for PCOS or type 2 diabetes, but both can be effectively managed and even reversed in early stages through lifestyle changes. PCOS symptoms can be controlled by improving insulin sensitivity, balancing hormones, and maintaining a healthy weight. Type 2 diabetes can go into remission with proper diet, weight loss, physical activity, and medical guidance. Medical treatment options. For PCOS, doctors may prescribe medications like metformin to improve insulin sensitivity, hormonal contraceptives to regulate periods, or fertility treatments when needed. For diabetes, treatment may include lifestyle changes, oral medications, or insulin therapy depending on severity. Medication alone is never enough. Lifestyle correction is the foundation for both conditions. Diet for PCOS and diabetes. Diet plays a powerful role. A low glycemic, anti-inflammatory diet helps both conditions. Focus on whole foods such as vegetables, lean protein, healthy fats, and fiber-rich carbohydrates. Avoid refined sugar, white flour, sugary drinks, processed snacks, and excessive fast food. Eating balanced meals stabilizes insulin levels, improves hormone balance, and supports weight control. What to eat? Include leafy greens, broccoli, cucumbers, berries, apples, nuts, seeds, eggs, fish, lentils, chickpeas, whole grains in moderation, olive oil, and yogurt. Protein with every meal helps prevent blood sugar spikes. Drinking enough water and avoiding sugary beverages is essential. What to avoid? Avoid white bread, pastries, sweets, sugary tea or coffee, packaged juices, fried foods, processed meats, and excessive rice or potatoes. Late-night eating and frequent snacking worsen insulin resistance and hormonal imbalance. Role of exercise and lifestyle. Regular physical activity improves insulin sensitivity dramatically. Even 30 minutes of brisk walking, strength training, or yoga daily can reduce PCOS symptoms and prevent diabetes. Stress management, adequate sleep, and reducing screen time also play critical roles in hormonal balance. Final message and call to action. PCOS and diabetes are not life sentences. They are warning signals from your body asking for care, awareness, and consistency. Early action can protect your fertility, your heart, and your future health. If this video helped you understand your body better, share it with another woman who needs this truth. Subscribe to Medical Truths with Dr. Nimra, because knowledge is the first step toward healing.